Hello and welcome to the Wednesday workshop. Today we are going through shoulder health. There's plenty to talk about with shoulder health. We're going to specifically look at painful arc, okay? So we're going to be looking at when people get pain going from the side of the body and raising our arm up, alright? It's a painful arc refers to when you have a certain degree of pain and then it gets better. So you'd be okay here, you'd be fine, and then around, it might be at this angle, but you'll hit an angle where it starts to get sore and it gets painful, okay? And then this range would be painful, and you find that when you get past that range, it feels a bit better, okay? So you have no pain, pain, no pain, okay? And you often will find that sometimes you can get pain right at the top as well too. That's often like compression right at the top. It could be caused by a pain in your AC joint. But that's not what we're going to look at today. We're going to look at essentially painful arc and how the rotator cuffs influence it. So the rotator cuffs are these little muscles that surround the shoulder joint. If we look at Ernest here, you can see the hip joint is this big ball and socket joint. It's steep, it's powerful, it's really stable. With the shoulder joint, it's also a ball and socket joint, but it's really shallow because it needs all this movement for your arm to move around, okay? So where you don't have that stability, but you have the mobility, okay? But for the lack of stability, you need something to look out for it. Because it's not strong ligaments in the capsule, you have these rotator cuffs going around the joint. And they're really important, and they need to work well. They don't need to be particularly strong, but they need to be efficient. Painful arc syndrome, it used to just be called like a subacromial joint pain or impingement, shoulder impingement, but it actually shows that you can have a lot of research has shown you can have this pain without any impingement, and you can also, on the flip side, have impingement or have rotator cuff tears without any pain. So it's now kind of commonly referred to as like just a painful arc syndrome. Often something drives it. It's different with each person, and the remedy might be slightly different as well. However, what we're going to look at, like I said, is rotator cuffs, that side of it mostly. When you have pain here, what we want to try to restore is the function of the shoulder joint. Now often you might have some things that are tight, and you might have some things that aren't quite functioning very well, not very efficiently. More often than not, when we're coming up here, things start to get squashed, and you kind of open up and twist your shoulder around them and they go completely unsquashed. A lot of this is to do with the control of your humeral head, so the top of the arm bone, and that's the control of the rotator cuffs. So the exercises we're going to look at are one, a single arm lat pull down, some rotator cuff activation, and then just some trigger ball work into the rotator cuffs themselves, just to try to get some relief. You can do these if you have that painful arc, and you can do most of these exercises as a general shoulder health as well. If you have a niggly shoulder, they're all looking at shoulder stability and returning some sort of circulation and health into the shoulder, okay? But this first exercise is quite specific to painful arc. I'm going to crack on with it now. You do need a cable or a band. I need to attach it to the door, okay? There we go. So I can get round all the way here. So I've attached my cable. I'm probably going to be quite tentative doing this because I don't want it to snap up at me in the face. But I've attached it to... I'll put it in the window. What you want to do at home is get your band, whether it be like one like this or like a really thin physio band, tie a knot in it, just a really simple knot, and then pop it on the other side of the door and close the door onto it, okay, and it's going to be locked in on the door. I'm going to have to get down low. You probably will also have to go on your knees because of the height of the door. It's not that tall. So let's say I'm working on my right side. So one arm lat pull down, okay? Now, for the purpose of the video, I'm going to be back here. In reality, you probably want to be a bit closer to the door, maybe just over an arm's width away. So when you have it up, it's quite high up. So you want to be doing this sort of angle. I'm going to be a bit further back. Just keep that in mind when you try it. You probably want to be a bit closer than I am. Pop a towel down or a yoga mat to support your knees. Alright? And you can either do it on your knees. If you're doing it standing up, which is preferable, if you have somewhere tall enough, maybe a staircase, then you can stand there with a slight squat and you're sticking your bum out, okay? I'm going to be down like this for you guys. The idea is to just simply bring it down to the side of the body, then they come back up, okay? You want to have the tension on all the way up here. So you want to have that, you're feeling it straight away, and then you bring it down to the side of your body, alright? The arm stays stiff, and you're really tucking in your bum cheeks, you're squeezing your abs, and you're feeling your shoulder engage. I don't want to see the shoulder up next to the ear doing this, okay? The idea is to settle it down and get it down there, alright? And then you want to focus on the eccentric phase. What that means is the way back up. So you've got it down for a count of 1, and then count up to 4 or 5 on the way back up. Pull down, count up to 4 or 5 on the way back up, keeping this down. And if I were to be standing, the band will be up here. Just imagine I'm holding it. You pull it down, it's braced, stay breathing, 5 seconds, the way back up. The idea, the theory behind this is that you're controlling the shoulder joint. As you're coming up, back up, the shoulder's going to want to raise with it, but you're using your rotator cuffs, sorry it's my phone, you're using your rotator cuffs to control the humeral head on the way back up. It's going to teach your rotator cuffs to work properly and work together, so that you can actually keep a good control of that shoulder head. You can be engaging through the trunk, so the co-contraction of the abdominals and the lats are going to also help the control of that shoulder joint. So that's a very specific exercise for painful lock syndrome, and it's a really good one. You want to be able to load it quite high. Just start easy, but then make it difficult for yourself. But remember, it's the control on the way back up, which is where you're going to get the main gains. Alright? The next one we're going to look at is going to be essentially just activation of your rotator cuffs. I may have been through this in the previous video, but you could do these really easy just against a wall. Rotator cuffs are, you're going to be external rotation and internal rotation, okay? So you're twisting the arm externally, or you're twisting it internally, okay? You can build these up. At first, let's say you've got a quite sore shoulder and you're actually struggling. You're just going to do isometric contractions. So get a wall, back of my chair is my wall. You're standing next to it. And I'm just going to go ahead and put a pillow between my body. You can use a rolled up towel. Squeeze that in, okay? And then push your hand out so you're externally rotating. Sorry. There we go. So this hand is going out against there. I just push that nice and strong. 15 seconds, relax. Push again, nice and strong. 15 seconds, relax. Okay? Do the same thing on the wall. You probably need a corner of the wall. Let's say, for example, I'm using this corner here. Alright? So internal rotation going in towards my body. Okay? I'm pushing in. And relax. Pushing in and relax, okay? About a 15-second strong contraction, okay? Once you've done that, you can do these a few times each, 3 or 4 times each. Build up to like about a 60 second engagement. So you either do four rounds of 15 or maybe 2 rounds of 30. And this can build, okay, to using bands or weights and at different angles. So now I could do this angle here and bring it up into external rotation and just hold and back down, okay? Or I could attach it to the door over there and I'll bring it into internal rotation, okay, and relax. And you just want to get some strong contraction, so you're not moving, but get about 80% strength through there. So you've done your one-arm pull downs, and then your engagements, your isometric contractions of your rotator cuffs. Essentially just getting those rotator cuffs working. And now, one thing that's often an issue, or getting above here, you grow these trigger points in a lot of the muscles. So, through here, you get your infraspinatus, some of your external rotator cuff muscles getting really tender. You get lumpy parts, you can touch them and they can create pain. You sometimes touch them and you get pain down the arm or up into the neck. So they're trigger points. We want to work on some of these. And there's one little sneaky rotator cuff that's hard to get to called the subscapularis. It's in the armpit, in here. It's underneath the shoulder blade, between the shoulder blade and the ribs. So it's hard to treat this yourself. I've never treated this on myself. It's hard enough treating it on patients in clinic because it's a bloody sore spot. But it's a good way to inhibit it by using other muscles. And if we use a trigger ball, it's a nice little trick that we can use a trigger ball on this muscle here, which inhibits, so it turns off this muscle in here. And at the same time, you're treating that infraspinatus, so that other rotator cuff. And for this, you do need a trigger ball. I do have mine up here, that's good. Or like a lacrosse ball, something similar. And you're going to be doing this on the floor. So this is the size of my trigger ball. It's quite hard, it's quite dense, it's a very slight give. That same work on my left shoulder. You're just going to lie down slightly on your side. Pop this here, okay? So it's on the shoulder blade, it's kind of like in the armpit. Okay, you can see my shoulder blade sticking out from my back there, see it moving around. I'm going to get it on there, okay? And just turn around so you can see. So on there, alright? It's not on my back, okay? It's on my shoulder blade. I'm just going to lie down onto it. Right, notice my foot is down, my hand is down, I'm controlling my body over that area. Roll around until you find the sore spot, okay? So this ball's rolling around my shoulder blade as I'm rolling over it. And you'll find the spots. My hand's out here. Once you find, you do your scanning. You're scanning around. Come over to your arm a little bit. Come to your armpit. Come a bit closer to your centre of your back. And there you go. For me, I found a spot there. And you know when you hit it because it will be really sore. Very focal. And like I said, it might shoot pain elsewhere. Just sit on that space, okay? And really sink into it. Sink into it a lot. And breathe deep. Come off a little bit. You want to do that for like 15 to 20 seconds. Come off, give yourself a break. Bit of a roll. Sink in again, okay? Then you can also try to do some activation. Some myofascial release activation. So you've got about half the pressure on, 50% pressure. And start doing some rotation with the shoulder, with the arm. So internal and external rotation. Okay. This is going to be a nice segue into another stretch that I'm going to show you in a little bit. Now with the trigger ball work, you can be sitting there for 5 to 10 minutes doing this, okay? There's no real rule. With the stretching, you know, say you might want to hit it for at least 30 seconds, make it dynamic, do some static. With the trigger ball work, just get on it, hit a spot that's sore, and work in it until you feel a change, alright? That change might not be a complete resolution of pain, but you'll feel some sort of change. when you have that change, whether it be 5 minutes, whether it be 15, then you can have a break. If you sit there for 20 minutes doing it, you're probably going to find the next day you're in pain. You'll find your threshold. So say you've done it for 20 minutes, next day you're going to be in more than a 4 out of 10 pain. That's probably too much. If you've done it for 10 minutes and the next day you're at a 4 out of 10 pain, then that's okay. I can live with that. And you can too, it's only 4 out of 10. But you don't want to aggravate it, okay? So that's going to be a way to actually work into the external rotator cuff and to inhibit this internal rotator cuff in your armpit as well. So they're the 3 main things you want to do for that painful arc, alright? And that's going to be what you're going to do if you have a really acute shoulder and you get sore there and you're really struggling to lift it up. So that, just go through that again. That's 1 arm lat pull down with all the contraction, 5-second raise back up. And then you do your activations of the internal external rotation, really strong, 80%. And then the trigger will work onto that external rotator cuff. If you're getting a bit of a painful arc or it's just a bit niggly, then you can try a couple more things to add a bit more stability. I'll go through quickly now. I think the first one I want to show you is sleeper stretch. Yeah, I'll go into that because I'm down there now. So firstly, trigger ball. You can do that all around the shoulder joint. Get it into your pec as well. If you get it into your pec, you can do it on the floor. Basically just lie on it. Get a good spot. And do some snow angels like that, okay? Just explore your body with that ball. Sleeper stretch is a super good one to then stretch out the muscle. It's nice to do after the trigger point work. And you're going to lie on your shoulder. Don't have your shoulder flopping out like this, okay? So then you can have all this range because there's so much accommodation within your whole shoulder joint. You want to lock this down to the pure glenohumeral joint, okay? That pure shoulder joint. So you really lie on top of it. Get it at a right angle here to your body, a right angle at the elbow. The idea is to, with this hand stays super relaxed. This hand does all the work. I'm holding on to it, okay? Sloppy. I'm going to push it down there. Right. If you find you go like that, you're not locking the shoulder down. You want to lock that down, okay? There you go, I'm stopping there. Now what I'm going to do is I'm going to resist. I'm going to push back up this way, okay? I'm going to resist with this hand. So I'm pushing for 5 seconds. Relaxing for 5 seconds, so I grab onto it. This hand's relaxed now for 5. And then I increase the stretch just by, a degree, a centimetre. Push for 5, pushing back up towards my window, towards my head. Relaxing for 5, and then increase. You'll find each time you only increase it by just a small amount. And after you've done about four of them, those increases, that's probably the end of the exercise, okay? So that's good for sleeper stretch. And essentially you're going to go into YTWs. I give this to most people. And it's just going through this is more of like a warm-up for a shoulder day at the gym. Or if you're doing anything with upper body. Y, it's like this, you make it a Y. T, straight up. And W's, make it a W, okay? You can grab a weight for this, like a 1 kilogram weight. I would use like a 2.5 and that's by far enough. Maybe even too much. A 1 kilogram's fine, half a kilogram's fine. Hold them in your hands. And you just get an activation. Do this for 20 seconds, maybe 30 seconds. T's, and then W's. Okay, you can do it in this plane and in this plane. So bending over, Y's, T's, and W's. Okay? Just do it till you get a burn. And again, if you're struggling with bad shoulder pain, you may not be there yet, but it's a good idea to try that. And then finally, I'll just leave you with one more thing. Snow angels on your belly. So, I'm going to go the other way. You're looking at engaging your shoulder blades, so you're squeezing your shoulder blades, lifting your hands off, and you're just coming up and around, okay? Not touching the ground at all, like you're doing snow angels. If you want to, again, you can put a 1 kilogram weight into the hands, like this. And the idea is to keep going for quite a few reps until you're burning and shaking. And that is just creating some stability and some function within the joint. There is actually one other exercise that I can't show you, but I'll describe it to you quickly. It's super good. This would be for gym goers only though. Well, I mean, I suppose you could do it at home if you have the equipment. It's essentially going to be an upside down kettlebell. So, you know kettlebell, you have the bell there and you have the handle on top. If you just grab like a really light one, like a 1 to 3 kilogram, hold it in your hand upside down. I can't show you because all I have is a 32 kilogram kettlebell and you can't do it that heavy. But hold it upside down and essentially do a shoulder press, holding the kettlebell upside down, okay? So you're still holding the handle, but you flipped it onto its head, so you're balancing it. So it's going to want to flip down, okay? So you're going to have to really squeeze with your wrist. And you're just going to do shoulder press. Okay, you can start with your elbow out and bring it out to the side, like this, okay? And again, that'll get your shoulder burning. That's going to be more of an issue of an exercise once your shoulder's better. Not something to do when you're actually struggling with pain at the moment. If you have bad pain there, just do your first 3 movements: the lat pull down, the engagement of the external and internal rotators, and then the third one. I forgot. Oh yeah, the trigger ball into the rotator cuff here. Okay, they're gonna help you basically manage that pain, and then feel free to go into the next stage, which is gonna be more of engagement. So you're actually moving the shoulders with the YTWs. You're doing your snow angels and things, and you can do the kettlebell work as well. The sleeper stretch when you're on your side, it might be a bit much if you're struggling with acute pain, but you might want to have a play with it just to see what you can get. Okay. So they are exercises for that painful arc syndrome. The main aim is to gain control over the rotator cuffs again. It's not to make anything stronger, it's to make things more efficient, okay? And that's everything. So give all them a go. Pop some comments below afterwards and let us know how you get on. If you're struggling, if you need a bit of help, just get in touch. Have a comment on the Instagram page, get in touch with the clinic. Feel free to direct message myself on Instagram and let me know what's going on. I could give you a couple of tips. If it's not helping, then we can arrange some sort of a consultation as well. Alright, have fun trying these out. They're a great warm-up as well for shoulder day at the gym. And have a great evening. Goodbye.